question. That's the way we feel. So we've got Algeria, Malawi, Zambia, South Africa, Haiti, 6:03 in the morning. Wow, that's dedication. Western Cape, hopefully the sun's shining there. I know it's been a bit dodgy the last couple of days. Tanzania, Karibu. Right. I'm going to get on to introducing now to the webinar. This is it's a joint event between the International Association of Public Health Logisticians, the South Africa chapter, and SAPICS. SAPICS is the professional body for supply chain management, and we're based in South Africa. I actually represent SAPICS, and 3 years ago, just before COVID, we had a discussion with IAPHL about trying to get IAPHL much more involved in South Africa. And I think that Walter Proper and Rachel Hart have done such a fantastic job in the last few years in getting all the local chapters, certainly in Africa, a lot more active and a lot more engaged. So I'm really excited to see so many SAPICS members, but I'm really excited to see so many IAPHL members from all over the world. If you're not a member of IAPHL, the good news is that it's free. But it's also outstanding value. So we'll put the link in the chat, and I really urge you to have a look and join. There's nothing ventured, nothing gained. There's lots of interesting dialogue that goes on, and lots of things really geared to public health, but also very relevant to anybody who's involved in supply chain management in any field. So we're very, very lucky to have Dr. Matowe here with us today. Lloyd is an old friend now, not age-wise, but time I've known him. And all the while I've known him, I'm just constantly amazed by his total energy and passion for the worlds of pharmacists and of supply chain management, and how do we align these, and how do we educate youngsters coming up, and how do we help older pharmacists actually learn more about supply chain management, a lot of which is done intuitively rather than having been taught the real science behind it. So Lloyd's got some really interesting ideas and things, and I love the title about reimaging the role. And I think that it's going to be a very, very interesting topic. So as I said, if you've got questions, please type them in the chat, but otherwise I'm going to hand over to the man you come to listen to. Lloyd, take it away.
Thank you, Jenny. It's really a pleasure to be here today. I see a number of preeminent people in the audience. I just saw Hazel, Professor Hazel from Cape Town. Hazel, it's good to have you. Quite a number of people I've worked with before. Some we've just interacted online, and also quite a number of students that I was with in Tanzania who were asking the question, how does somebody get into supply chain from a pharmacy background? And I said, look, there's no other entity than SAPICS that could help you realize, actualize, and possibly make the transition with information. So it's an informed decision. And this, for those who are seeing SAPICS for the first time, sure, clearly it won't be the last time. They have a lot of good things and a lot of important meetings and capacity building initiatives for the young professional, both young and old alike. So to Jenny and the team, Cindy, Tonya, thank you for giving me this opportunity to speak, with the supply chain fraternity and also with the pharmacy fraternity alike. I will speak for about 30 to 35 minutes and then leave ample time for discussions and questions if need be. So I have a slide deck that I'll share. And so if you allow me, I will share these slides with you. Okay, here we are. So as Jenny said, deliberately, we wanted to see what we can do to make pharmacists more relevant in the supply chain space. And to go through this, I'll go through a journey, starting with what is pharmacy? So the official definition, the scientific and professional definition of pharmacy is the science or practice of the preparation and dispensing of medicinal drugs. The science or practice of preparation and dispensing of medicinal drugs. That is pharmacy for you. What are, for the young pharmacists and students who wish, who aim to get into pharmacy, what are the career paths for pharmacy? And there are quite a number, they are diverse. And in this presentation, I choose to pick on just 5. Pharmacists work in clinical pharmacy, where we have the interface with our patients. Pharmacists also work in the pharmaceutical industry, where they work in different elements of manufacturing the medicinal products. In most countries where we live, pharmacists also work in retail pharmacy, traditionally known as the community pharmacy. Apart from these 3, pharmacists can work in the public health space, where, in inverted commas, supply chain is a subset. This also includes vaccines, the cold chain, and then other element of public health, including health promotion and policy. And finally, the 5th element I chose to pick on today is academia. Pharmacists do teach in a number of fields, not just in pharmacy, but they do provide pharmacology and pharmacological support in medical courses, including nursing. I'll talk a little bit more about clinical pharmacy, and this is where we see most of pharmacists working. This includes working in hospital, dispensing medication, monitoring drug therapy, including preparations of injections, and then overseeing the drug administration. The clinical role of a pharmacist also includes specialist roles, such as a pharmacist working in cardiology, in HIV and TB, in cancer, and in children. That's where we see 60% of our members working in. The second is the community pharmacies and clinics, where pharmacists in a broad dimension are managers. They also work as general staff in clinics and in retail pharmacies, and also as a manager of staff and the system. The third element is in academia, where pharmacists, they do work as teachers, as trainers, and as provider trainers on different elements of the medication use. And this includes selection of medication, developing therapeutic regimens, changing those regimens, and also in research and lab practice. So I said before, pharmacists also have the option, if they wish to work in the pharmaceutical industry, in what we call big pharma, where there are 4 main roles that pharmacists can work in, including marketing, including what we call R&D, research and development. In research and development, they do clinical trials, which is testing if a drug works or if a drug continues to work. And then the formulation of the medication. How do we manufacture creams, tablets, and capsules? Then pharmacists also work in insurance schemes, what you call pharmacy benefit management, where they do risk assessment and advise on the specific regimens that can be reimbursed on medication schemes. And then finally, pharmacists work, in this industry, patient safety and quality improvement. And this is an area we call pharmacovigilance, and also an area that we call drug regulation. Now, this is where we come in with this particular topic. Of late or recently, pharmacists have been playing a more significant role in public health. And in the public health space, where there is mass treatment and programs to treat HIV, AIDS, tuberculosis, malaria, mental health, among others, we see the pharmacist as the interface between the clinical practice and the supply of these medicines. And that's where the linkage or the marriage with supply chain begins. And some of this area includes working with non-governmental organizations, the ministries of health, and international organizations. So, what is the issue? What brings us here today? What am I saying? I'm saying what I've presented in general terms is specific to systems. There are differences between health systems in developed countries and those in low and middle income countries. Now, if the systems are different, a curriculum meant for the United Kingdom or the US or for Australia does not necessarily address the needs of the people in Zambia or in Malawi. So there has been, and there continues to be a mismatch between what we train, how we train, and what our countries need. So where do our pharmacists work? Where, talking of a mismatch, where do they work? And I'm only going to give one country as an example because of time. In Zambia, 87% of our pharmacists and pharmacy technologists, they work in the government sector. 87% of our pharmacists work in the public sector. Of these 87%, less than 1% are involved with direct clinical care, just 1%. With regard to industry, Zambia has 3 pharmaceutical manufacturing companies only. With respect to the whole of Africa, the whole of Africa has 642 pharmaceutical industries, 642. Switzerland alone has 475. So in terms of manufacturing capacity, Africa is almost the same as Switzerland. India, with almost the same population as Africa, has 13,000 manufacturing industry. Why am I bringing this up? Because it gives a context to where pharmacists we train end up working. All the pharmaceutical skills and information and theories that we give them end up as being merely academic. So those 87% that work in the government sector, and we said only 1% are doing clinical work. What roles do they actually perform on a day-to-day? Pharmacist in a hospital in the north of Zambia, in the south of Zimbabwe, in Durban, in Namibia, in Ghana, what do they do? Very similar in Africa and other developing countries. They do the procurement of medicines, whether it's locally or whether it's abroad. Pharmacists are an integral part of the procurement system. Once drugs come into the country, they receive. And in country, when drugs or medicines come from the central storage areas, including central medical stores, they receive the medicines. And pharmacists are responsible for the storage of medicines. Storage of medicines come with how to manage the inventory, how to record. That's pharmacist's role. Pharmacists also issue and dispense medication. So why did I bring this up? Because this is what 87% of the people we train end up doing on a day-to-day. And this is the marriage with SAPICS. All these bullet points, procurement, receipt, storage, distribution, issuing to patients, overlap with supply chain. So in essence, we're teaching our students 90% of science, and they end up doing 87% supply chain. What am I saying? This is the Bachelor of Pharmacy curriculum across the world, including in Africa. First year, they teach science. It's all science, physiology, anatomy. The second year, they teach science. There's your pharmacology, chemistry. In third year, they teach science. In fourth year, they teach science. And why? Why is it the case? Well, because that's what tradition has told us. People are resistant to change. We don't change very quickly. In Zimbabwe, a curriculum which was developed in 1979 in Rhodesia has changed very little. Still teach our students the same curriculum which was adapted from the University of Bath in the United Kingdom. And this is replicated over and over again. So let me elaborate. The core pharmacy subjects. Pharmacists have got 5 core subjects. One is the pharmaceutical chemistry or medicinal chemistry. And I don't want to be very technical, but this is just the chemistry, of the medicines. Second core subject is pharmacognosy, which is really the interface between pharmacy and botany, medicinal plants. Number 3, pharmaceutics. Pharmaceutics is the science of manufacturing and preparing medications using technology or otherwise, because that's needed. That's where we learn how the tablets are made, how they are, pressed, what do we put in those capsules. Number 4 is pharmacology, which is really how the drugs work in our bodies. And the 5th subject is pharmacy practice and clinical pharmacy, which is the interface with the patient. Why am I putting this here? Why is that important to the non-pharmacists and to the pharmacists who know this as well as I do? Because this is the beautiful sciences that we never use, the beautiful pharmacognosy. I would like, since I graduated from the University of Zimbabwe in the late 90s, I want to see one student who ended up in pharmacognosy, probably 1 or 2. The rest of us ends up in supply chain. So I call them the beautiful sciences that we rarely use. What's needed? What's the paradigm shift Am I advocating that we drop all sciences and start teaching supply chain in pharma schools? No, I'm not. I'm not that radical. I want the change, but I'm saying let's do a needs assessment of what our systems want. And that's the paradigm shift that I present, or a plan, the big plan for pharmacy training in Africa. Needs. What are the needs? Local, regional, at national level, and also it's a global world. If you need to graduate, from the University of KwaZulu-Natal, but you want to end up working in England, is it transferable? Then yes. So it's a balance. We don't want to create professionals that are siloed in their own countries because we are taking care of needs. We want to address the needs, but also professionals should continue to be cutting in terms of where they are, where they work, and where people want to be. If you want to work in the USA, are you able to pass the exam and be registrable? So it's a balance. But first and foremost is we train for our local needs. Locally determined, right at the top of the slide. Services, that the services needed. What services are needed? And do our graduates provide these services? You see in the middle deliberately, there's the broader vision. It's a vision. And at the bottom, really, really important, and SAPICS is a platform for this, the supply chain competencies. And on competencies, before I elaborate more, for most people here, you may want to know that in October, we have supply chain workforce development workshop, competencies, supply chain in Zambia, here in Lusaka, people that deliver PTD. Some of you may want, to attend this if you're in Zambia. And maybe Jenny can put a link in the text about the PTD in Taba, where the issue of competencies will be interrogated. But back to this presentation, it's exactly what we are asking. I put in 5 bullet points on functions for pharmacists today, supply chain functions. Are they competent enough? Have they been trained? Then, of course, the education, right? Global focus to make us continue to discuss, exchange ideas with other global players at the same level, just like any profession, like lawyers, like, doctors, pharmacists, in Algeria, pharmacists in Ghana, and Tanzania, and Zambia must and should be able to sit on the same table and speak this pharmacy language. Let me summarize this key slide for me, the paradigm shift. Every curriculum must and should do a needs assessment. What does the country need? Not just in terms of the numbers, but the minimum skills required of the trained cadre. Service provision, services that are needed at the country level, and then matching the service needs to competencies, and then providing the relevant education that's needed to service that. But clearly, we are a human being, all of us, not just pharmacists and supply chain, resistant to change. We want to continue. I was reading, thought how radical it was in the UK, an article last week, where medical doctors are going to be trained as apprenticeships in an apprentice way. It's not the traditional sit-in class. They will be, under supervision from the word go. It's not trying it anymore. It's already ongoing. There are people who are brave to say, look, the world is not, constant, it's dynamic, needs change. And because of this, we need to embrace this, both as supply chain and as pharmacy. From supply chain, from SAPICS, from ARC, if they are there, from Jenny, from business schools, is to realize that if a pharmacist wants to be trained on supply chain, they're quite capable of being trained and becoming a supply chain cadre. For pharmacy, having a pharmacy degree does not in any way make you a supply chain expert. Far from it. But erroneously, we actually do think that we can run a central medical stores by virtue of having a pharmacy degree. It's not a clinical setting, it's a supply chain venture. So recent events that interrelates with the last slide I was talking about. There have been huge investments on health and pharmaceutical interventions, including medicines and vaccines. The Global Fund has spent over the last 10 years over $20 billion on pharmaceutical interventions, including medicines and vaccines. USAID has spent over on HIV alone, over $15 billion for products. And of course, the technical support is focused on getting the product to the people, and rightfully so. We are spending so much money to procure commodities to save lives, then it's only prudent that they reach the people and they save lives. Now, pharmacists, and I said here rightfully or wrongfully, so they followed the investments because we all need to work, we need jobs, we need a good salary. So we have gone into this public health space where we now find ourselves managing huge investments in commodities. But the training of the pharma system, has it matched this shift towards moving into the public health space? Fortunately, no. Training of pharmacists has remained pharmaceutical in nature, and yet pharmacists remain adamant that it's their territorial space. The management of commodities must and should be in the domain of the pharmacist. If that's the case, whether it's at a policy level, whether it's at a political level, whether it's at a professional level, we find professional bodies actually standing up and saying, no, you cannot have a non-pharmacist running our medical stores. Is the person that you want to run it appropriately equipped with the skills and competencies to run such an adventure, call it an adventure? Because competencies and good practice are critical for optimum outcomes. So the mindset, it starts with the mindset. And I've got two sentences here, just two. A pharmacist, a clinical pharmacist, if there's a spillage, tablets, they are spilled and they go on the floor, clinical pharmacist will sweep away the tablets on the floor and throw them into the bin. A trained supply chain pharmacist will count his losses. These commodities are money. They are valuable commodities. And finally, the practice. Practice is knowledge is power. We are appropriately and well-trained, equipped with the right skills, we'll find ourselves doing the right thing. I thank you. This is my presentation. Thank you, Jenny. Over to you.
Brilliant. Thank you so much. Bosco, I think, yes, we will, with Dr. Matowe's permission, we'll share your slides, but we also have recorded, we are recording this session, so we will share that for everybody. I love the way that you present. So for someone like me who really didn't know half that information, no, 3/4 of that information, it was very easy to follow, but also really, really interesting. And you know, your discussion around the idea of pharmacists being territorial about their role it's not just pharmacists, I don't think. I think it's everybody who, if you don't know the importance and you don't know the science behind the supply chain, it's very easy just to take it for granted, you know, just to assume everybody understands it and is doing it the right way. Has anybody got any questions for Lloyd while we're here and while we've got his attention? Because I promise you, he's the busiest man in the whole of the cosmos. And the fact that we have him trapped, albeit virtually, the fact we have him trapped for another 25 minutes, I would really encourage you to ask some questions. And don't be shy. If you would like to put your hand up and unmute your mic, then you're more than welcome to do that if you don't want to type. You know, we've got the opportunity to engage, so let's do it. Trouble is, I now can't see people putting their hands up. Hold on.
Innocent has got the hand up there.
Thanks, Tonya. Go for it, Innocent.
Thank you very much. And I wanted to take this opportunity to really appreciate Dr. Lloyd for his eloquent presentation. And I think it so resonated very well, even with my local context in Malawi. And I also love the fact that I think we see a lot of presentations where people just present the challenges without necessarily presenting what are the proposed solutions. And so I love that at the end, there was that paradigm shift that he sort of articulated very well. My only question to Dr. Lloyd would be, which are the particular micro shifts that you think would be very critical to actually be able to catalyze this paradigm shift? Are there any sort of, basic, micro shifts that you foresee that could be helpful in this particular paradigm shift, or is it really contextual depending on the training in different countries? Thank you very much, and over.
Innocent, thank you. Really good question. It's a very good question that you ask, a genuine good question. People have tried piecemeal, because there's funding. USAID provides money through some of its implementing partners, realizing that this is really an issue. And what then ends up happening, and I actually worked in Tanzania at Muhimbili University, School of Pharmacy, and Innocent, you are aware of the pharmacy assistant training program in Malawi. There are quite a number. This piecemeal, this attempt to make a change, it's not good enough. What I'm saying is, a two-week module on supply chain in a 5-year program, it's not going to produce a pharmacist who is a supply chain. It just can't do it. Now, I said we do need to do a redress, do an assessment of the needs. Do we then end up with a pharmacy curriculum which is half supply chain? Not at all. I didn't say that. I'm saying our assessment is able to give us the balance that we need. Now, the micro shifts that's needed. Number one, it's really at a policy level. At a policy level for the country to say, this is what we need. And for Malawi and for Zambia and Zimbabwe, right now, Innocent, people in pharmacy fraternity have been shouting, we need a PharmD. And for those who are non-pharmacists, the PharmD is the pharmacy training program piloted and being used in America to train pharmacists who are almost 100% clinical. The focus is on the patient. But now I am saying we are now focusing on PharmD when 87% of our role is supply chain. Are we getting it right? Because we want to follow the US model where, we focus on our patient. So the microshift, the policy level accept that, this is obsolete. Our training programs are obsolete. Apart from, the policy level, it's also in academia, the academics. And we see in most of our universities in Africa, they taught us, these old school professors, they're very good. They're good, they gave us the career we have now, but now it's time to look at, what we were taught in 1990. Does it still remain relevant the way it is? Some remain, but some things need to change. I hope I answered your question, Innocent. Thank you. Good question.
I think that's a great answer, and I think it's just that's a situation across education generally, is how do we keep academia up to date with what actually need to be the outcomes? What do the people who are going to be practicing need to be taught? And Bosco, I know you've got quite a lot of comments about certifications and also about education. And we've also got a question which sort of links in, but how do we get universities to incorporate the core supply chain education into the pharmacy certifications?
Yes, I see there are a couple of hands as well, Jenny. I don't know if you are seeing them. Hazel, I say hands up, and Aaron. But let me answer this. The point, these pharmacists, the pharmacists who are on this forum, and that's my key point of discussion. That look, if your core is was 20 years ago, as a clinical and science focused, then don't clamor for supply chain positions. Let the supply chain people who are well trained and equipped with the competencies to do supply chain, let them run supply chains. The challenge is you want it all. You want a training, a training that focuses you on the patient, on the bedside. But you end up, distributing medicines and doing inventory, which you're not well trained for. And somebody comes in to your warehouse and they tell you, look, I'm an engineer with a postgraduate in supply chain. You say, what is an engineering doing in my house? So it's the mismatch, the disconnect. And that's really what we have to address. And we all follow resources. We're following money. If the money is in supply chain and products, then let's train those who want to own the commodities appropriately. Mm-hmm. Thank you. Jenny.
Yeah, great answer. I hope that helps. Now I'm seeing the hands up. Hazel, would you like to ask your question?
Yeah, hi everybody. Yeah, my name is Hazel from the University of the Western Cape in South Africa. Yes, I've really enjoyed your presentation, Lloyd, and you're probably speaking to the converted here, but I've long said, that pharmacists need to be trained for what we need in our country. And yeah, some of my research, which centered on sort of pharmacists working at district and sub-district level and provincial level in South Africa, found that, pharmacists don't just need clinical competencies, but they also need public health responsibility competencies and management competencies. So, as well as being involved, some of the things that I think I didn't hear mentioned so clearly were, how pharmacists should be considered key members of district health teams, key members of provincial teams for planning purposes. So they need skills in order to understand the burden of disease in their country, in order to, be able to contribute meaningfully to those teams. So I certainly agree that pharmacists do need some of these public health competencies, and some of them I think can be gained, from the BPHARM curriculum, and of course that would need probably a little bit more work with countries in order to change the curriculums. But yes, some of it perhaps needs to be, through further sort of training through maybe some short courses, or, like we do a Master of Public Health. There are some Masters of Supply Chain as well. So it's probably going to be a combination of, trying to make the initial pharmacy qualification and motivating to make the initial pharmacy qualification more relevant, but also then providing opportunities for people to study further in their areas, just as there are clinical pharmacy courses up and coming around the world and increasingly in Africa. We also need to have, these other qualifications and training for pharmacists too. So it's more of a comment than a question. And yeah, I really hope to engage a bit more with this community going forward, because I certainly think it's saying some of the things that I really am very strongly feeling about. Yeah, thank you.
No, it's yeah, go, Lloyd.
Go ahead, Jenny, you first, yeah.
No, finish first, because
I just wanted to say, Hazel, it's good to have you on this panel. And for those who are not in pharmacy, Hazel is one of our opinion leaders in pharmacy, in pharmaceuticals. And yes, I do know that you've been an advocate for the role of the pharmacist in public health for long. And yes, I do hear you. I hear your comments well. There are missing pieces here, the management pieces, the pharmaceutical management pieces, for a pharmacist. And what Hazel was saying as well, now for pharmacists, is sometimes, look, these niches in profession, we create them ourselves. The supply chain were low-hanging fruits. Pharmacists didn't create them. There were needs in public health, and people brought commodities, and pharmacists then, saw that as an opportunity. So in addition to doing what's needed, and we can also get that from doing this needs assessment, it's a lot of management roles that pharmacists can take, especially, in the remote areas in rural Africa, in district hospitals in rural Africa. We can become really, really critical piece in the healthcare system, instead of just following everybody to the bedside. The patient now has 7 people surrounding them. The pharmacist is there, the physician is there, the nurse is there, the other things we can do, we can need, which is helpful to the system. So thanks, Hazel, for your comments. Really, really, helpful, and I do identify with them. Thanks, Jenny.
So interesting. Aaron, you've got your hand up. Would you like to unmute yourself?
Hey everybody. I heard the doc saying about pharmaceutical, the core 5 courses about the practice, but all I know is that he mentioned of Pharmacognos, of which the only thing I know about it is about academia things. So I want to know the places where you can work when you tend to major in Pharmacognos, apart from academia.
Thank you.
Thank you.
So, Aaron, your question is a good question. Again, for those who are non-pharmacy, pharmacognosy is botany. It's really the medicinal plants, the science of, the medicines from medicinal plants. And you see where it came from. It came from historically, 90% of our medicines were coming from plant and animal products. So people needed those skills to be able to manufacture and discover new medications. It's still needed now, but less and less. Medicines are done in the lab. They are discovered in the lab, Aaron. And so you see more and more people having lab skills than pharmacognos skills. So the point I was trying to make was not to create opportunities for pharmacognos person, or it was to say to you clearly, especially those in leadership in universities, that possibly there is need to reevaluate the amount of hours and materials that we are teaching our students. So pharmacognosy is taught from 2nd year through to 4th year. It's a lot of hours, conduct hours for students in a course that I then show that after you graduate, we end up as being, remember, those science that we don't need. That's the point I was trying to make, Aaron. Not, to guide you on where to work when you do pharmacognosy. I'm sure there's still some places here and there, but not just pharmacognosy. A number of the courses and the conduct hours and how they are structured are due for a review on whether they are making our countries and the world better. Thank you, Aaron.
Yeah, I just wanted to call Bosco, because you had quite a lot of chat, and I don't know whether you want to unmute yourself and chat to Lloyd. Volunteering to help be the bridge in Tanzania, and obviously lots of experience in this area as well. That was Bosco Mapunda. But he might not be here still now. Can reach out to you afterwards. And there's a question here. What are the plans for taking the ideas presented today to other forums, such as the FIP, who have worked on the global pharmacy competencies? That's a really great question, and I know, Lloyd, you'll be able to answer that one.
Yeah, it's a great question. It's a very good question. I was on the competency framework for FIP, and FIP developed a document. You can find it out there. It's online. The role of the pharmacist in supply chain. And I actually did a foreword for that document, Jenny, as PTD chair. It's very rich, in the role of the pharmacist in supply chain. What it doesn't do, and it doesn't go far enough on the how-to. What we're proposing now is, how do we get there? The document tells us specifically they can do procurement, and they can do, inventory management. You can do, port clearing as a pharmacist. You can be, managing inventory at a district level. But how do you create this cadre? And that's where this question is really, really important. How do we get there? It's a policy change, needing change in policy direction. It's really, really important. If we don't have that, we'll continue to talk and talk with no change. The small changes that we have, and I would want, Jenny, I would want you to, into context. How do we bring core supply chain into negotiations such as this? What can SAPICS do to all these young pharmacists who are here because they want a role in supply chain, but they haven't quite figured out how to get there? And most people, IAPHL is here. Most young pharmacists who want the transition to supply chain, I don't want to speak ill of anybody, but there are a few courses online that are advertised aggressively, and you end up with a diploma in that, and you find yourself, you're stuck. So where is the transition to being a wannabe and to being a practitioner? And I want you, Jenny, to address that.
Yeah, it's so important, because so much of the time there is phenomenal conversation, and then it just goes dead. And that's where I think that the synergies between organizations, professional bodies such as IAPHL, SAPICS, people that deliver SILT, and another couple were mentioned in the group chat, SIPS, from a procurement perspective. We have to work together, and with organizations like FIPS, because there are so many different professions into which supply chain management should be core and should be a core skill, but people don't understand it. And I keep on saying, and people are bored of me hearing it, but one of the COVID silver linings is that for the first time in my memory, ordinary people are understanding what supply chain is, or more, what happens when it goes wrong. They don't get their tissues, they don't get their medicines. So COVID has at least highlighted that. Now we need to capitalize on that and get people understanding, as you say, Lloyd, it's the how.
Thank you, Jenny. That's really, really helpful. And on top of that, in addition to what Jenny is saying, there's really, really a need to see supply chain, as a field or in its own right. It is a profession in its own right. So it's a transition. People should not see it as just an add-on. It's an add-on, and just go in there and you can pick boxes. Then you're a supply chain professional because you're working in a warehouse. They transfer you from a district hospital to a central medical store, and then the next day you're a supply chain, specialist. It doesn't work like that. It's a lot of effort, a lot of work, concerted effort that you have as a young pharmacist, as a young professional, you put into developing this. And also from the supply chain fraternity. And I don't think it's a competition, really, because you can get engineers who become really good supply chain experts. You get teachers who become really good supply chain experts. And pharmacists must see that as well, that I'm a pharmacist who go on to become a supply chain pharmacist. You don't become a supply chain expert by virtue of your pharmacy degree. It's a bachelor of pharmacy degree. It's not a supply chain qualification. But also, and that's where the SAPICS angle is really, really important. It's not just the diploma that does the transition. It's a lot, of steps that are followed. Mentorship, identifying the need, and then eventually, of course, you do get there. You do get there if you want, but it's a really, really good area to go into if you understand the nuances and where you're coming from and where you want to get to.
Yeah, and I think one of the very first sort of quotes when I first went to my very first public health webinar was, why expect a doctor or a nurse to become a supply chain professional? Because what happens is you lose a good doctor and you lose a good nurse. And that it's finding that balance and getting people trained in the areas that they really need to be able to do their job effectively and ethically and efficiently. I think that's the thing. There's one quick question. We've got 6 minutes left. So to gain the necessary knowledge and competencies for supply chain, do you need to get an MSc in supply chain management or a certification in SIPS? Nathan, that's a question that we could debate for hours and hours and hours. And I don't know that there's one specific answer. I think that there are many answers to that. And I think it's also going into understanding the end-to-end supply chain management and which organizations and which degrees offer that true end-to-end context. But Lloyd, you might want to have a comment on that one, or anybody else?
I was going to defer it to you.
Okay, so I will make a copy of all the chat because I know I've missed some questions and I'm very sorry about that. But we will come back, we will share the questions and we'll share some answers as well. So no one will miss out. And as I've said, we will also share the recording and the slides because there's been such a great engagement. This has been wonderful, Lloyd. I'm very, very grateful to you for your time because, as I said, I know you are the busiest man in the whole of the cosmos. But I think I hope that everybody got as much out of it as I did. I, for one, as a non-pharmacist and a non-supply chain person, I will never look at a pharmacist ever again in the same way. They don't just dispense drugs. There's a whole lot more to it. And supply chain management is only a small part of what they do. And I'm very grateful to all of you for being supply chain professionals and keeping the world turning. And to the pharmacists out there, thank you for making sure that we get the drugs that we need in the right place, in the right condition. But most of all, thank you very much, Lloyd, for all that you've shared with us and the education that you've imparted.
Thank you, Jenny, and thank you everybody for attending this session, and congratulations to SAPICS for all these events. They're helpful and they educate and they capacitate the young. So thank you again to you.
And quickly, just to your point about the white paper or all the writing that you've done, if you don't know people that deliver, I really encourage you to go on to the People That Deliver website. I think it's peoplethatdeliver.org, because there are so many incredible documents and white papers and research that's been done. And I think often it kind of gets a little bit hidden in the website. So have a good delve around there. And on the SAPICS, we'll also share the SAPICS YouTube channel, because there's a lot of very good presentations that are there too, from the various conferences and all the webinars that we've done over the last 2 years. So there's more than enough to keep everybody learning.
And Jenny and your team, I would like you to do me a favor. Look at all the charts questions and look at the most intelligent from a student. You do the judge. And that student will be sponsored by me to come to SAPICS next year in South Africa. It has to be a student. Question in the charts from a student that you think stands out will be sponsored to SAPICS next year. Thank you.
That's fantastic. I've muted my mic because I have a dog about to go ballistic because somebody's at the gate. So, but that's an amazing offer, and we will certainly do our homework and we will let you know and we will let the student know. But thank you very much.
Thank you, Jenny. Thank you, everybody.
And how's this? We're right on time. So thank you all very much. I hope that everybody's got time to nip to their next session or get back to work. I'm going. Bye.
Okay, bye-bye.